since sharing my earlier pregnancy videos as well as my article series on ultrasounds, I've received lots of messages from lovelies asking me, Fleur, that's all great, but what does a low intervention pregnancy look like? Now that I'm pregnant with our third baby and I'm in my third trimester, I thought this would be perfect timing to share with you the low intervention pregnancy series, and you're now watching part one, your first trimester. Hello lovely, my name is Inge Fleur and I'm a fertility homeopath. I help couples worldwide to fall pregnant naturally with the information on this YouTube channel and my DIY and life programs. I believe that a low intervention approach is the best thing that you can give yourself and your baby to be able to carry into that second trimester, but you need to do it sensibly, of course. And that is what I want to talk to you about in this video. I'm going to give you lots of suggestions, lots of things to think about, lots of practical tips, but also point you towards resources. And because I'm sprinkling that everywhere, I figured you would really benefit from a guide. So I've got a downloadable for you that I'll be linking in the description or in the comments somewhere down below. So you can watch this video, lean back and listen and see what resonates and what sticks, and then use that guide as your reference later on. Before I go into all of the things that I did and didn't do, or I suggest to my patients to have a low intervention pregnancy, I figure it would be valuable for us to touch on why I opted for a low intervention pregnancy. And we can start with that very first trimester. The thing is, some of the things, and especially things like ultrasounds, give us a sense of false security. On the other hand, I feel like apart from all the conventional procedures and protocols, that there are a ton of things that are actually really overlooked that can reduce your chance of a miscarriage. And they are hormone related, they're nutrition related. And so I think it's really important that we do pay attention to those things and reduce the emphasis on most of the conventional things that are offered to us as women in that first trimester. Also, if you start with a lot of interventions right from the start, you go from intervention to intervention into intervention into intervention, and studies just show that poses more risk also for the birth, but at any point in the pregnancy. So having a bit of a standoffish approach, I really think it benefits both you and baby so much, as long as we stay sensible, right? Because a lot of these procedures and these ways of diagnosing and you name it, they are there for a reason. They can be helpful, but I don't think we should just automatically opt in and just go with the flow. And I want to empower you with the information of this video and subsequent videos on how you can do that, because I want you to feel like you are still in control. You're making the choices for you and your baby and your family, rather than that you're giving away your power, because you're always going to be there. You're always going to be there for yourself and your baby. Those practitioners aren't, and they're also never going to know you as well as you know yourself and you know your baby. So I want you to be equipped to make informed decisions that are right for you and your child. Now let's look into the things that I did to have a low intervention first trimester. And I have done this for all three kids actually. And the first thing that I opted out of was ultrasounds. Now I will refer you to my article series on ultrasounds because it's way more in depth and it refers you to research as well as what your alternatives are to the things that ultrasounds normally offer you, like sizing and the date of your conception, etc., all those kind of things. But I opted out of ultrasounds just because they're really offered in a way as if they're completely safe, but they're not completely safe. And the big authorities on pregnancy in different countries even say this, that use them only when medically indicated. Because the reality is ultrasound waves heat up cells. And this is not so much a problem when you are, you know, a full-grown human being. You can lose a couple of cells here and there. We lose cells every day. But if you are only a little tiny embryo and all you are built up of is a couple of cells, and that cell that gets heated up too much and gets destroyed is meant to become a heart or meant to become a brain. Well, that's a big issue. And I noticed that this was happening to a lot of my patients. Initially, they had missed miscarriages. So usually they're not spontaneous miscarriages when it's ultrasound related. It is the typical story of, I went in for my scan, there was a heartbeat, everything was fine, and the next ultrasound, suddenly the baby had apparently died right after the ultrasound. How weird is that? But then the body never interpreted it as, oh, baby died. And that tells me that, first of all, is the developmental issue, of course. Secondly, very coincidental that with so many of these women, well, actually all of them that I spoke to, that the baby died right after the ultrasound. And then the third striking thing is that the body didn't recognize that there was that the baby had died. So the missed miscarriage, the body continues to be pregnant, so there's nothing the matter with the body, and it hasn't received the memo that baby is no longer there. And there are always people, whenever I talk about ultrasounds or opting out of them, on, here on YouTube or on my social media, that say, oh, well, ultrasound saved my life, or ultrasound this, ultrasound that. And that's all fine. There are things that you can say that ultrasounds do bring, but in general, they don't increase the outcomes of healthy live births as much as is being promoted, while there is an actual danger there. So as long as I'm one of the few voices that will warn against ultrasounds, that's what I will focus on the warning. And then you can use that information to do your research and then opt in and out of ultrasounds as is relevant for you, as feels right for you and your family. I completely understand if you've had an ectopic pregnancy in the past that you're more apt to have another ultrasound, right? But even with ectopic pregnancies, there are other things that you can look out for that don't necessarily need or require an ultrasound right away. And I do explain this exactly in my article series as well, so I definitely recommend for you to check those out. But if you aren't having any ultrasounds, then there are other things that you need to look out for, right? For example, the ectopic pregnancy signs, certain types of pain that come up, or HCG levels in blood tests. And then you can always decide to opt for an ultrasound because, again, ultrasounds are there when medically indicated. So they have a time and place. 100%, you will not hear me say that they should never be used. In fact, although with Lily Rose, I didn't use any ultrasound so far with this baby, which we call stip, which means dot in Dutch, although it's more like a football right now. With Noel, we did have an ultrasound 30 minutes before he was born, not because I thought it was important or relevant at all, but because the hospital personnel just didn't know how to feel what position the baby was in, which personally I think is ridiculous because you can feel it, but I wasn't going to make a big deal out of it in that moment. He was head down. I felt like he would be damaged the least by the ultrasound by that point. It's really that first trimester that is especially critical, but it doesn't mean that there are no losses following ultrasounds in the second or third trimester, because I know of cases where that has happened. So you're going to have to tune into your body a lot more. When we rely less on all of the procedures to tell us if everything's going right or wrong, it reminds us that we are responsible and we need to pay attention, right? So pay attention to any bleeds. Pay attention to contractions. If you're actually feeling contractions, and there's a difference between Braxton Hicks and contractions, but if initially you have difficulty distinguishing, that is completely normal. You can talk to your midwife about it. And as I said, certain types of pain that could indicate an ectopic pregnancy. Another thing that I have done with all 3 pregnancies is I continue charting. The charting isn't going to tell you everything, but as long as your temperature stays up high, that's an indication that your progesterone levels are good enough, you're going to hold on to a pregnancy. Then that is something that you can kind of cross off your list. Like, okay, well, I've been monitoring that. That looks good to me. If your temperature does drop, always monitor that as well, because there are ups and downs anyway. And after, especially the first trimester, more or less, because this is the first pregnancy that I've actually monitored the temperature throughout the whole pregnancy to see what happened. Eventually, the temperature does go down, goes back to your normal baseline as you would have it in your follicular phase. But initially, if you have like a drop, that can be an anomaly. But if you have an ongoing drop, then that could be an indication that progesterone is dropping. And that could be due to two things. Either you do have a progesterone issue, but if you've been charting, you will know this. You can test for progesterone levels, and I would recommend to do that early on in your pregnancy just to make sure, because why would you lose your baby just because you haven't supplemented with progesterone, right? Let's not go overboard and just supplement everybody just in case. Also, if you're stressing out, that can influence your progesterone levels as well. So keep that in mind. But a dropping of progesterone could also just be an indication of that you are indeed miscarrying, because if there's a developmental issue with your baby and your body recognizes it, then progesterone will drop so that you have your flow. I have a specific video on the supplementation of progesterone while you're trying to conceive as well as in your pregnancy, so I can refer you to that resource as well. I think you will find it really helpful. Well, on this topic of progesterone, the third thing that I did this pregnancy, which I haven't done the other two, was take homeopathic remedies to support progesterone production. And that is for several reasons. When I fell pregnant with this baby, I actually thought that I was maybe hitting perimenopause because I had like really wacky cycles and lack of ovulation. And then I introduced a couple of remedies that got everything going again. I wasn't like in the best position, potentially. Not only that, having already two children and knowing that I struggle with adrenal fatigue, I knew I could potentially be at risk of lower progesterone levels. So I took homeopathic remedies that were specific to my case to keep progesterone levels up. And I do the same with my patients that have known progesterone issues, or they have known other hormonal gland imbalances. I will say just take these specific remedies depending on what their case is, and take it up until the moment that the placenta takes over progesterone production, which is around week 12. I also had homeopathic remedies stand by for irritable uterus. Now, I don't really have a history of that with the other two. I've never miscarried before, praise God, really. Because although I have done lots of things to reduce the risk, you cannot eliminate the risk. So I know I've been really, really blessed with that. But especially me being older, and there were some other signs, I thought, well, you know, it's possible that I'm not able to hold on to this pregnancy. So I had those remedies stand by, and I have that for my other patients as well that have a history of miscarriages that started with the contracting. Now, these remedies I also have on my Growing Bump program. Growing Bump is such a cool resource that I'm working on to expand. It's all about supporting you in a low intervention pregnancy from the first trimester all the way to birth, even jump starting, labor naturally, homeopathic remedies to help you within the birth. And I'm also working on a fourth trimester module there, and I'm really excited to continue building this out. Now, on the topic of homeopathic remedies, I also had other homeopathic remedies stand by, or I used them for any kind of first trimester discomforts that I was experiencing. So loss of sleep and the nausea that I was really struggling with. I also have a video on morning sickness in which I do mention a couple of those remedies and on some other resources. And it's going to be very different from the standard that you always hear, like, make sure you have crackers beside your bed and make sure you hydrate. No, none of that is going to be stuff that you haven't heard elsewhere. So I will make sure that you have access to that in the resources guide too. I know from lots of women that they really love that video. And other than that, the other homeopathic remedies are really supportive whenever you're dealing with any kind of issues that are just common and normal for pregnancy, and you opt out of drugs that are offered quite fast. I find you can just, you know, you have your alternatives. You don't have to sit back and suffer just because you have a low intervention pregnancy. And I'm certain that without all of this, I would have ended up in hospital dehydrated and diagnosed with hyperemesis. But I'm not sure there's going to be a fourth baby, I can tell you that much. And I think the big part in this as well is that we don't like suffering. We really don't. We want a quick magic pill for everything, right? Can't fall pregnant, give me a pill so I can fall pregnant. I feel sick, give me a pill so I don't feel sick. I have a headache, let's take this. And I really think we need to revisit that. Suffering is part of life, and suffering is, you don't have to suffer unnecessarily. That's not what I'm saying. Discomfort is part of life. You know, it helps you grow, it really does. And I think it's also a sign that we sometimes need to cut something out of our lives rather than just muting the annoying symptom and just keep going on the same track. It's often a check engine light. And when it comes to extreme nausea, extreme fatigue, or you know, even mild, it's just a sign that maybe you need to accept that that is playing a role and that's something huge is happening to your body and that you need to listen. I'm not good at listening. I'll be the first to tell you that, but it is something that we need to do. So leaning into acceptance and that it's going to be temporary, I think is really, really important and really helps you grow as well. It's going to help you tons once baby is here and you can't keep your house perfectly neat like you always did. So speaking of nausea, what I really tuned into this pregnancy as well is I binged. Binge is the wrong word, but I binged on nutrients and supplements while I could. I knew that there was going to be a moment that nausea would hit and that I just wouldn't be able to tolerate foods, and I wasn't going to force myself because that is not good either, right? That is not listening to your body. So I binged on nutritional foods. You may already know that I'm a big fan of nourishing traditions, and I highly, highly, highly recommend that for anyone that is trying to conceive, but especially in pregnancy, as long as you can take it. And then after I let go of restrictions when nausea hit, I just ate crap, if that helped me. Although, you know, eating crap usually makes you feel more crap afterwards. So it was also a bit of a weighing out, like, am I really going to take this gummy bear to feel a little bit better temporarily? And sometimes the answer was yes. What I love, 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 love that I also did is the pregnancy tissue salt program, and you can access this for free. It is I've included this as modules on the Growing Bump program, but these modules in specific are for free, and I've had, I think, thousands of women access this information now over the years, and you can do the same because pregnancy is a time where you're going to need extra minerals, and the tissue salt program is a way for you to get those and also to get them more out of your foods. And the pregnancy tissue salt is built up in a way that it supports every phase of your pregnancy for you personally, but also for baby. So that may mean that in the first trimester is very focused on implantation support and on tissue support. Later on in pregnancy, it's more focused on avoiding water retention. Later on, it's focused on elasticity so you can give birth. So I highly recommend this. I think you will love it. And then the last important thing that I prioritized right away is make sure that I booked my postpartum doula and my midwife. Practitioners that are willing to work in this kind of holistic and low intervention way, they are a rare find. And I had to leave my previous midwife because we had moved and I just lived too far away now. The cool thing is that we moved within the same radius of my postpartum doula, but the midwife was a different story. So I had to change to a midwife group. We live now in a more remote area, so my choices are very limited. And I have this midwife group, and this is why it's really important to start as early as possible to find the right people, because when they are in your area, they're often booked very quickly. And if there isn't anyone just right in your area, you're going to have to vet them. And I recommend that Ina May's Guide to Childbirth. This is an amazing resource anyway that you really, really, really want to have at your fingertips. So here are a couple of things that, in addition to the things that I did, that I also recommend to my patients and that you can pick and choose from. And the first one is that I emphasize to start with an initial opt-out approach. so that you're going into this pregnancy of, I'm opting out of everything that they offer me. And why is that? Not because I'm telling you to opt out of everything, but it changes your mindset that you're going to look at it in a way, okay, how is it going to benefit baby and me? If you're going to consider every procedure and protocol and whatever as a yes, unless, then you are more likely to go into the whole flow. And intervention leads to intervention. That is the thing with a lot of the tests that are offered in the first trimester as well. They are going to put you in a position that you may need to take measures, that you need to make a decision. And so the question is always, what are you going to do with the information you're going to get? Whether it's with an ultrasound or it is with genetic testing as well. I did consider genetic testing for this pregnancy because I thought if something's going on with this baby, I still have 2 older children as well. We would never, never abort. But I did think it could help if I knew something might be up with baby, that I could prepare for that. But the reality is a lot of the outcomes are often wrong or inconclusive. Then how is that going to help? Right? Right now, I have no idea if this baby is okay, apart from that it's moving and it's growing and it has a steady heartbeat. Maybe when it's born, it has a cleft palate or a lip. Possible. Maybe this baby has Down syndrome, but we accept it as part of life. And I'm also just not going to assume everything's going to be fine. I'm preparing myself in advance, like, okay, life may throw us a curveball, and how are we going to love this baby and take care of this baby however long we get to have it? And of course, I hope that everything is fine, and everything was fine with Noah and Lily Rose. But, it's possible, and we're going to deal with it when it comes. Alternatively, if in the first trimester I may have heard something about something might be wrong, this whole pregnancy would have been filled with anxiety, right? And now I've cherished this baby every step of the way, and that is what I wish for you too. I told you that. Cherish however long you have with this baby, whether it's hours, days, months, or years. You want to think in advance, like whatever the outcome is of this test, what am I going to do with this information? Is it going to cause me to have to push back a lot, to opt out of a lot of things that I don't want anyway? Or is it actually going to be helpful? Blood tests. I do think that, especially when you're not doing any ultrasounds, I've already mentioned there, blood tests that are really, really, really helpful to do, because with some of the outcomes, whether it's certain hormones or it's certain nutrients, if the outcomes aren't good, you can do something about them. You can supplement either with synthetic hormones, although it's not ideal, but I mean, it's better to keep your pregnancy, or nutrients, so that your chance of a miscarriage reduces significantly. I talk about these blood tests on Growing Bump so that you have that extra information. And I think that gives a lot of sense of security, especially when you're not doing any ultrasounds anyway, but also it's going to give you information that you're not going to get out of ultrasounds, and that I feel like are really, really overlooked. And a lot of losses are really unnecessary if only the simple blood tests would have been done. And as I mentioned earlier, one of those is the progesterone test. Urine tests are done more and more routinely, and often bacterial growth is picked up on, which is completely normal because hormone balance changes immensely in pregnancies, especially the first trimester. And that can include then that you're more prone to candida overgrowth, to bacterial overgrowth, but that could be temporary and your body is fighting it. But instead, it's picked up on as, oh, you have a UTI. Let's start you on antibiotics because an inflammation is dangerous and it could cause a miscarriage. True, but if you're not having any symptoms yet, especially, antibiotics themselves can cause miscarriages. And it makes me so sad, the amount of pregnancies that I've seen end because of antibiotics. And antibiotics, certainly, there's a time and place. But first of all, just bacterial overgrowth and white blood cells in your urine, especially if you're not having any symptoms, doesn't immediately mean that you have a UTI that needs to be treated right away with antibiotics. And secondly, homeopathically, you can do so much to treat that. To date, I have never had a patient that I wasn't able to treat for UTIs, for bladder infections, that had to resort to antibiotics. So it's really, before you take them, really think about what you're doing and how you're approaching this. So I've told you a lot about opting out, right? So how are you going to stay occupied? Because that first trimester, especially, you are like really living towards that moment that maybe the nausea drops, the fatigue drops, but also that you see a bump. Like, let people see I'm not just getting fat and lazy, but something's growing inside of me. Now, I recommend that you focus on the positive things to research. What really helped me and what helps my patients as well, to, if you can tolerate it, right, because of nausea, research nourishing traditions for yourself in your pregnancy. There are some great resources online about pregnancy diets. I can definitely link one into that first trimester guide, but Sally Fallon has a really amazing book that I love, that I recommend, and that I send out to patients and friends when they're pregnant. Then research things like baby wearing, research things like cloth diapering, research things like co-sleeping. Those are really fun things to research, and this is a great time to be doing that. Listen to podcasts that are building you up. That's the best I can recommend to you. And that way it's so much easier to let go of the anxiety as well and the control. But if you're really struggling a lot with anxiety, which I totally get, again, there are homeopathic remedies for that. And I have a separate module on growing bump for the first trimester, because I know from my patients that they make all the difference. So don't forget to grab your free first trimester resources guide, links down below. And if you're keen to watch more natural pregnancy or low intervention pregnancy videos, then definitely click on the thumbnail on your screen right now. If I already have the second trimester video filmed, you will find that linked in, and otherwise there will be a playlist with tons and tons of videos that I have for you. And in the meantime, see you in the next video. Bye.